Hello, and welcome back to another episode of The Conscious Artist, a safe space for conversations around mental health awareness for musicians, artists, and all human beings. I am your host, Pallavi Mohidara, and I am thrilled that you are joining us today. I love the community we have developed together through this show, and I'm committed to continuing to give a platform for voices and stories to be shared. When we allow others and ourselves to feel seen and heard, we create much needed change in this industry and in this world. So thank you for supporting this community. Don't forget to subscribe wherever you get your podcasts, and let's get started. My guest today is the president of the Personality Disorders Awareness Network. He has served as Director of Development and was on the board of National Education Alliance for Borderline Personality Disorders, where he focused on sponsorship relations and co-organized conferences on the subject. Please join me in welcoming my guest, Dr. Frederic Bien, to The Conscious Artist. Frederic, thank you so much for joining us today.
Hello, Pallavi. Thank you so much for having me. It's an honor to be on your podcast.
It is my pleasure. Today's episode is about personality disorders and awareness. And I feel that there's quite a large lack of awareness in terms of the disorders themselves, but also causes, recovery, and any sort of context around the disorders. In fact, I think as a society, we can be quite quick to label someone, for example, as a narcissist or a behavior as OCD, for example, without full understanding of the terms and disorders. So to begin, could you discuss firstly what are some of the different personality disorders?
So indeed, the family of disorders, mental health issues called personality disorders, are not very well known by the public still. It's starting to change in the last 20 years or so. And it's only been about 50 years, I would say, that personality disorders are being taught and used a lot in the mental health profession. And therefore, it's a more recent family of mental health issues than depression, anxiety, or bipolar disorder. And therefore, it's perhaps normal that people are still trying to understand, what is exactly a personality disorder. The categorization of these disorders, was made official through the Diagnostic Statistical Manual in the US, the DSM, as well as the International Classification of Disease, the ICD, in the rest of the world, I would say. And the two of them are not completely in sync with, the classification of those mental health issues, which has added to perhaps the public lack of understanding of what we are dealing with. A second aspect of this is the terms, right? Personality disorder are very much putting in question the person who received the diagnosis. And therefore, a number of people who might be deemed to have a personality disorders are rejecting the fact that they actually have a disorder. Third, I would say, and I'll get into this a little more later, there is, a general distinction in mental health between sort of the very conscious disorders, so-called Axis 1 disorders, and, the less directly conscious disorder called Axis 2 disorders. And personality disorders for a while were categorized in the Axis 2 side, which means that they were not necessarily symptomatic on the forefront of people's behavior. And the move from Axis 2 to Axis 1, is relatively recent. But with that being said, I can explain that officially in the traditional DSM-4, DSM-4R, DSM-5, there were 10, personality disorders that were listed. Paranoid, schizoid, schizotypal, antisocial, borderline, histrionic, narcissistic, obsessive compulsive, anxious or avoidant, and dependent personality. With an 11th one, which was the unspecified category. these, 10 or 11 were grouped into clusters, cluster A, B, and C, as they were called. Cluster A contained paranoid, schizoid, schizotypal. Cluster B contained antisocial, borderline, histrionic, narcissistic. Those were probably by now the more popular one, the better understood. Cluster B is also labeled sometimes emotional or erratic disorders. And then in cluster C, you have the anxious or fearful disorders, which is avoidant, dependent, obsessive compulsive. And just to give the nickname for cluster A was the odd or eccentric disorders. At PDAN, the Personality Disorder Awareness Network, so it was originally created in 2001 by Randy Krager, who is a famous author in the US of the book Stop Walking on Eggshells. And she had a couple of partners worked with her. And the initial goal of the group was really to focus on family members of people who have personality disorders. Family members sometimes suffer from the challenging, erratic, some might say at times feeling like manipulative behavior of people with disorders. And Brandy's specialty has been to write books, for family members. And the group evolved for the next 10 years with a little bit of support from the community, but I would say it didn't really blossom, partly because of lack of organizational skills, administrative skills from the founders who, were not that interested in running a large organization. And then in 2011, I came into the field, as you mentioned in the introduction, through NEA-BPD, which is the National Education Alliance for Borderline Personality Disorder. We organized a conference together in Atlanta, which was quite successful at the Carter Center from President Jimmy Carter, whose wife, Rosalind Carter, was a big advocate for mental health and especially insurance parity in the US. After that conference and a similar one in New York, Westchester, I felt that we needed to refocus perhaps the message of NEA-BPD on families and children in particular. And so Randy was ready to sort of pass on the reins of PDAN. There was a lady named Mary in between who had also taken on the leadership but didn't want to really continue. And so I inherited, the little group that existed. We reincorporated in Georgia since I live in Atlanta. And we started publishing books for children that explain to kids the idea of emotions being a bit like the weather around us. And therefore, our parents potentially having emotions that they cannot control. And the kids are on the receiving ends of these emotions and sometimes are blamed for those emotions by the parents. And it was important to sort of strengthen the identity, the personality of the children to realize, okay, there is what I do and my behavior, but then there is also the mood that my parents might be in. And this has to be distinguished, separated somehow. So I don't think that I am responsible necessarily for the way I'm being talked to. So the conversation around these books started in social media. And this was 2012. Facebook had maybe only a couple 100 million users at the time. I had just come out of a startup company in the field of social media called Blink Media, which was focused on helping big brands bring their messages into the field of social media. And I utilized some of my skills there to sort of promote conversations around the children books in social media. And something very surprising perhaps happened, because until then, it's important to say, because we kind of forgot now, 13 years later, that at that time, the reputation of people with borderline personality disorder was largely shaped by books like Stop Walking on Eggshells on one side, by movies like Fatal Attraction or Girl Interrupted, where the people with BPD in particular, were portrayed as sort of the most difficult of the difficult people to deal with. Yet we took at PDAN, as well as at NEA BPD, an approach that was much more caring to say, okay, these people did not ask to have BPD. We didn't ask them to have BPD, but they have something. And therefore, we need to figure out a way to live with them, to adapt to them, so that we can continue all living, the rest of our lives somewhat happily. And that message of compassion and empathy towards people with personality disorders resonated in social media like an echo chamber. And it was very surprising, I would say almost spectacular, to see in 2012, 13, 14, that suddenly we attracted a large group of people with BPD who not only followed us, but said, hey, I want to speak because I want to tell the world how I feel and what it feels like to have BPD. This was really sort of miraculous for us in terms of growth of the organization in social media, but also because these people came out of the woodwork from having been castigated, as the pariahs on the edge of society, to now, being able to explain how they were feeling, and the fact that many of them were in therapy and were trying to be better, and some even were actually recovered. And so that shift that happened, was what PDAN sort of was able to support, turbocharge, amplify. And now, we have close to 800,000 followers in social media. The page has often reached several million people per month. And many of them are suffering from a personality disorders. Many are feeling supported by the group and are happy to find other people like them. And it's a very different situation in 2025 than it was in 2012.
Wow, thank you so much for sharing all of that. You sort of already answered a few questions I wanted to ask you, and I so appreciate that because I think the bottom line of everything regarding this topic, I would say, is a lack of education. Lack of awareness comes from lack of education, right? And lack of education often leads to stigma and shunning people to the side, as you said. And so I appreciate very much what you are doing with the organization, with the awareness, with creating this very, very large and widespread community where people do feel seen and heard and valued as human beings. Because at the end of the day, I'm pretty sure every single one of us has some sort of disorder or the other. And it was very interesting for me when you were listing the different personality disorders. Of course, I was aware of schizoid, paranoid, bipolar, multiple personalities, borderline, narcissistic. But what I was less sort of aware of as a disorder was like the avoidant, the dependent. And I wonder if there's also a lot of lack of understanding and education and awareness with that, because I think anyone that goes on social media that follows any sort of therapist or therapy page or mental health page will see the kind of buzzwords that are like avoidant attachment style or anxious attachment style. And that there's a lot of talk about that in relationships, for example. I wasn't even aware that those are also classified as actual personality disorders. Could you explain a little bit more? I mean, I understand that you're not, a psychologist or psychiatrist, but you have a lot of experience with this. And, so if you can, would you be able to clarify a little bit more what is avoidant personality disorder versus dependent versus anxious, etc.?
Sure. So the personality disorders, and I can refer people to, ideally the DSM and DSM-5 in particular, but one has to pay to be able to read it. Otherwise, Wikipedia actually does a pretty good job at summarizing the information that comes from the DSM. The PDAN.org website, PDAN.org, also has a few pages about the various disorders. So there is a way to, look at first personality, right? In these different models of personality, what shapes our personality. There is two main components to our personality. There's a character and a temperament. So the temperament is viewed as what we inherit from the environment we were born in, inherited biologically, while the character is more kind of our own will that creates a behavior that is our choice, so to speak.
Essentially, nature versus nurture?
Correct,
Okay.
exactly. Now, nature and nurture are perhaps a slightly different division in the sense that there is what we inherit biologically, there's what we inherit through being taught, right? And then there is still what we choose to do, right? So that part is very important. Do we have a choice to be lashing out when we are angry, or do we have to do it? Okay. And do we have to do it because our genes tell us to do it, or just because that's how we saw it done before?
Well, most behavior is learned, right? Because, for example, we all have a choice in terms of how to react or not react to something, but it comes to what we've learned or not learned. And we can change and rewire things. But of course, like a lot of people tend to be very reactive because we aren't taught how to regulate our emotions from the beginning, right? So, how does that fit into all of this?
Right, right. Well, that's a very deep question that you just stated, right? Do we have a choice? Do we really have free will? Okay. As you know, there are professors of psychology at Stanford University, that question the idea of free will even recently. On top of free will, we have to add the ideas of religion and godlike destiny and fate. So we have to accept the fact that the behavior we see from other people is coming from, two or three sources, as I've mentioned, right? One is the genes that they are made of. They were taught a certain way to behave based on their childhood. And then there are still choices that we hope they can make on their own. But those choices are not always as strong as people think, right? And I would like to suggest to people listening that what you think about addiction, for instance, and especially substance use, alcohol addiction, or possibly, you know, addiction these days, even to social media or to digital media, could be a model for what happens in personality with emotions that are more traditional, such as you irritate me, and now I'm going to do something to you because you irritated me. And those reactions are not easy to control. We all have a little bit of addictive behavior in us. We all have a little bit of disordered behavior in us. And it's sort of a blood pressure model that we need to adjust or think about as we move through the world, right? Too little blood pressure is not good. Too much blood pressure is not good either. We ideally are in the middle somewhere. And similarly, if you do something to me and I find that irritable, then it's actually a good thing that I feel something, right? If I didn't feel anything, I would be in the camp of too few emotions, which is sometime where potentially the world of autism lives, right? And then on the other side, you have hypersensitivity and people who feel too much. The slightest little irritation becomes kind of grinding your teeth next to their ears or something that makes them feel like really upset. And yet you felt I was just doing my usual stuff. Why are you overreacting? So we all have different blood pressures, right? We all have different capacity to regulate our own blood pressure. And similarly with emotions, we all have different capacities to control emotions, to maintain flexibility, to maintain reasonable behavior, and to have interpersonal skills that are fitting well. So I know I want to get back to your question about the different type of personality disorders, but I wanted to make sure people understand that in order to talk about disordered personality, we first have to agree on what we talk about with personality. What is our personality? And there are different models of personality that exist. I can refer people to, psychology textbooks to learn kind of a three-dimensional model, a five-dimensional model. And once we agree, that there's a certain thing that constitutes this inner statue within us, which is a personality, then we can start talking about potential disturbance to that inner statue that would be in the realm of disorders, right? And so when you talk about paranoia, schizoid, schizotypal, the odd or eccentric disorders, they are connected to the fact that the people there have irrational suspicion of others, mistrust of others, or they have sort of a cold affect and a detachment from other relationship with others.
And those are classified as type A, you said?
Type A, correct.
And those, for example, are they constituted as a chemical imbalance in the brain, or are they constituted as something that can be rewired because it's a personality disorder, as you're saying? Like, for example, often people will say with anxiety or with depression that it is a chemical imbalance in the brain, and therefore with medication, that imbalance can come to a balance. And so, how does it work in this case?
Very good question. So this sort of connects to the relationship between personality disorders and mood disorders. And again, when we'd have to define what is a mood exactly, right, compared to a personality, because sometimes you would think that mood is sort of a visible part of our personality. Mood disorders tend to live in the axis 1 that I had mentioned earlier. They are typically hormonal imbalance, chemical imbalance, and they can be often corrected by medication, but not always. People talk about drug resistant depression, for instance. Right. And so, by the way, depression is part of mood disorders, so is bipolar disorder. So, personality disorders are, as I mentioned earlier, perhaps connected to this inner statue that we have in us that constitute who we are as a person. Temper or character or reaction to stimulus coming from the outside. They could be expressed in terms of mood. They could be expressed also just by a behavior, which is to withdraw, right? And to sort of essentially hide our moods. We don't know exactly where personality disorders exist in our brain, in our mind. It's still a debate, which is in fact going as far as some people are saying that there are no personality disorders. You only have personality adaptations. And adaptation would be a better term than disorders, truly, because we are all humans. We have to accept that some are hypersensitive, some less sensitive. However, the idea of disorder for personality has now become part of the general acceptance of psychiatry and psychology. If I can focus for a minute about cluster B, I will explain a little bit better. But just to finish on cluster A, I will say that the cluster A personality disorders lead to people having a potential to develop schizophrenia and psychosis, psychotic disorders. Okay, which is what schizoid and schizotypal refers to. In the cluster B, you have what is called fear-based disorders. And so those disorders tend to be stemming from certain types of fears that people experience to a degree that can be extreme. So borderline personality disorder, BPD, is often associated with the fear of being abandoned. Being abandoned physically, emotionally, can be a very challenging fear for some people who have lived in their childhood through such episodes, including trauma, which is very connected to BPD. Trauma can be defined as any credible threat on our sense of survival. So, if you analyze that idea of credible threat on a sense of survival, of course, it includes being in a car accident where potentially someone else very close to you dies, or it could also be being made to feel worthless to the point that you want to disappear or disintegrate, okay, through psychological abuse or physical abuse or sexual abuse, potentially through circumstances like caught in a war and suddenly becoming a refugee and being chased by people who want your family dead, right? So those circumstances that you can think of, with the wars we have around us these days, are still affecting thousands, if not millions of people, continue to live in our psyche as we age, as we go from age 5 to 25, and can, you know, create scars like essentially the damaged body of a car after a car accident, right? Except we don't see it like a damaged car. And so people are living with those scars and suddenly meeting a conversation or a person who makes them feel again like, I don't want to be with you. It's too much, blah, blah, blah. I'm going to leave. And you're going back to that place of trauma where you felt really like, okay, this is the end of my life now. And now you overreact, right? And the person who just said, oh, I just meant I'm going to go to the movie without you because you can't decide what you want to see or something like that, you know, feels like, why are you reacting this way? I just said I'm going to the movie. I'll be back.
I see. And so, if I've understood correctly, all of these different types of personality disorders, as you say, are a combination of what has been passed down genetically, what has been transmitted through upbringing and the environment, whether it's parents, school, country, war, atmosphere, whatever it is. And then, of course, trauma that each person has gone through. And at some point in their life, everyone has experienced some sort of trauma. Pain is pain, whether it's a paper cut or a gunshot wound. The word is the same, right? So, have I understood that correctly?
Yes, yes. I think that's a good summary of the things I've said. I do want to say that there are four important types of fears that are associated with a cluster B. I've talked about the fear of being abandoned connected to borderline disorder. Then there is the fear of being ignored, which is connected to histrionic disorder. The fear of being inferior, which is connected to narcissistic disorder. And the fear of being controlled, which is connected to antisocial disorder. So to take them, one by one, and especially talk about the fear of being inferior, which is connected to narcissistic. So first thing I want to mention is for a quote unquote normal person, the fear of being abandoned or the fear of being inferior are not big triggers. Because if you feel stable in yourself, if you feel okay, you'll have a sense, that's okay, I'll survive, right? But for someone who has been in traumatic situation, especially in their childhood, who has been made to feel inferior or on the verge of abandonment, those can really bring back very strong emotions. So there's a BPD, NPD, dichotomy or, duality perhaps that makes these two types of fears sometimes get people to be attracted to each other. So you'll find a lot of couples where a person has traits of BPD and is attracted to a person with traits of NPD and vice versa. BPD, NPD couples, there are many examples. NPD men, often with BPD women. NPD men may be, alpha type male, but also prone potentially to having more than one partner and seeking that validation coming from being, attractive to many females. While BPD person, is very sensitive, we tend to yearn for the things we want to have, right? And of course, the BPD person can be amazing girlfriend, a wonderful person to be with, often very physically attractive also, but then conquers a NPD man thinking that the NPD man is not going to change. And now of course, people do change through life, and the clash happens after a few years. Those two personalities, I often found as being somewhat toxic for each other, but yet there is an important aspect to personality, which is sexuality, can lead to romance that initially feels like amazing, but then after some time becomes kind of explosive, if not catastrophic.
Right. And the thing about like anxious attachment style with avoidant attachment style, it sounds very similar to what you're saying. From what I understand there, through what psychologists say, that it's essentially the opposites that are attracting because each is seeking in the other, unintentionally attracted to what they had in their childhood. So, for example, an anxious attachment person will often end up in an unhealed way, of course, if they're not aware of their tendencies, if they're not aware of the sort of triggers, but they'll often end up with an avoidant attachment person because that is often what they had in their childhood. Maybe a parent that was emotionally unavailable or emotionally absent. Right? And so I guess in all of these situations, they are quite toxic pairs because they are the unhealed versions of ourselves that are seeking that healing in partners without consciously understanding why or where it comes from.
Correct. Yes, yes. I was told once a theory which is pretty interesting. I don't know if it's true completely or not, but that we tend to pick as partner a person who has the personality type of the parents we got along with the least. And it's an interesting idea, right? That we want to be loved equally by both parents, but sometimes we feel a stronger connection with one of our parents. But yet we pick as partner in life a person who resembles more the other parent. That's because in us, we want to feel sort of equally worthy from both of our parents. And sometimes we end up putting into, the role of the unrequited love, I would say, the partner that we pick. This association between personality disorders and fears that become sort of irrational fears. I've talked about BPD and NPD. Those two, I want to say, are the most talked about and perhaps most recognized personality disorders within the family of 10 that I mentioned earlier. There are very few people who will come through as saying, I have paranoid PD or schizoid PD, whatever. I have met some who had been diagnosed, but they're very few compared to the throngs and thousands of people who have BPD, accepted it or claimed it. And, you know, there's also good therapies that exist for BPD that have become now quite popular, such as dialectical behavioral therapy, which is sort of a superset of CBT, cognitive behavioral therapy. The work of Aaron Beck for CBT was expanded by Marsha Linehan with DBT. So in the US, in America, the DBT standard of therapy has been viewed as very effective for borderline personality disorder. In Europe, there are a couple of alternatives. Mentalization in the UK is a very good style of therapy developed by Peter Fonagy and Anthony Bateman. You also have something called TFP, transference focused psychotherapy, which was developed by Otto Kern, I think. That was sort of a contemporary almost of the great school of psychotherapy from Vienna. I had a chance to meet him a few times. Very nice man, almost like what you would expect from Freud if you could meet Freud. For BPD, the situation is much better than for the other types of therapies. NPD also has a style of therapy called schema therapy, which has been viewed as working pretty well, developed by Jeff Young in New York City, and has a whole society of practitioners, the Society of Schema Therapy. Has also had some success with antisocial personality disorder, which is often found in individuals who unfortunately end up committing criminal acts and maybe in jail. So Countries like the Netherlands have done amazing job at working on therapy for people who are caught in the justice system. The numbers speak for themselves. The Netherlands have 1/10 the population density in jail compared to the US. So it's a huge difference to have 1/10. In the US, is about 2 million people in jail. If it were the Netherlands, we'd have 200,000 people in jail. So 1.8 million people would be freed. I've worked with some of the therapists in the Netherlands, some of whom come from New York, by the way, but couldn't get the audience, couldn't be heard in New York for their ideas to recover people with personality that commit illegal acts. And many of them can be reintegrated, And I work with a therapist of a man who had been a murderer when he was younger and now was a father to his kids and was a good person. And so the idea of change is fundamental also to understand personality disorders. I want to spend just a few minutes talking about this because it's so important. People think about personality as something we have and will keep forever. That's what has caused people who have been labeled or diagnosed with personality disorders to be irremediable, to not be able to change. But the truth is that our personality is a bit like our teeth. Our teeth, are a very solid part of our body, and we tend to think we can't really change our teeth. Fast forward from, beginning of humanity to 1950 or so, when orthodontics was discovered. And nowadays, anybody can change their teeth. It takes 2 years. It's not something that happens over a couple of appointments, but it's been accepted that you don't have to live with the teeth you were born with. And similarly, I strongly believe, and I think a lot of therapists would say, that we can reshape our personality. We may have been born and had accidents through our childhood, traumatic exposure, that made the body of our car, the statue we have inside us, somewhat dented, but we can reshape it. And through therapies like dialectical behavioral therapy, we can retrain ourselves to respond to something that is very irritable, potentially feels like a traumatic attack inside us, with a response that is calm and is allowing relationship to continue. So this idea of rewiring of the brain, I like to think of it, as I say, realignment of our strong reactions.
Right. This is so interesting. And actually, hearing you speak about this is reminding me of the first time that I came across the difference between character and personality. And this was in a book by British Indian monk turned author Jay Shetty. His book is called Think Like a Monk. And he spoke about the difference between character and personality. Character is who we are truly at our core, our deepest, authentic selves at our core. And generally, that character is shown and shaped early on in childhood, and that remains till the end of our days because it is who we are at our core, deep down inside. But personality is what we have been taught, essentially, how we have been shaped based on what we have learned from the environment around us or from what people say. And I'll give like a specific example. I have in my life been labeled always as a perfectionist because I have been always very detail oriented, and I'm a Virgo. And, one of the classic sort of bullet points of Virgos are, oh, perfectionists. Society has told me since I was young that I'm a perfectionist. I had absorbed that into my personality for a very long time. And I remember the day I discovered in therapy with my therapist that I don't have to be a perfectionist. It is a choice that I can make how I want to respond to something, because essentially perfectionism is a desire to control what generally is not controllable, right? It's a desire to make everything around us perfect in order when actually we don't have that control of anything outside of ourselves.
Mm-hmm.
And I remember the day I realized, like, wait, I don't have to be a perfectionist. I don't have to do everything perfectly. It's okay if it's just 80%. That was like a huge revelation for me. And it was such a big reminder that our personalities do change and can change with time. And sometimes they change for the worse, sometimes they change for the better, but we can also consciously change them. And it's hard because when you've been wired a certain way for X number of years or X number of decades, and suddenly to wake up and realize that, oh, maybe I don't want to be that way, or I don't like that part of myself, and I don't like how I feel when I'm in that sort of mindset. I would like to have a freer connection with myself or a freer connection with the things around me. How can I get there? That's a really scary path. And it takes a lot of time to rewire and to unlearn so much that was either self imposed or societally imposed or culturally imposed. Imposed from family members, etc. So, if I'm understanding correctly, that's basically what you're saying, and that for me was a huge revelation.
Yes, and I'm glad you give this example, right? And I hope people listening will be able to distinguish the step that you made in that therapy session where you realize, okay, I don't have to be a perfectionist, because this is exactly the key step in, I would say, recovering or realigning, our personality traits that are off the main line that they should be on, I would say. And so, it goes back to this model of saying, okay, we have our temperament, our character, and our behavior, right? And we choose our behavior. The character was sort of nurtured to us, temperament was natured to us, but we can choose the reaction. And it's interesting that you mentioned Jay Shetty, because I was listening to an interview of him interviewing a lady recently and talking about the let them theory. I don't know if you saw.
Yeah, Mel Robbins, right?
Yes, yes.
Yes.
And I thought that let them theory is very good and very useful, right? And she was distinguishing the difference between let them and let it go.
Right.
And so this let them empowers you to say to yourself or to people, okay, I can let them yell at me. I don't have to yell back, right? Rather than let it go where, okay, I'm going to ignore it and pretend that I'm not hearing it or whatever. No, you actually, inside you, give them permission to talk this way, but it doesn't mean you have to internalize that for yourself.
Right. You take the power back in your hands with how you're going to respond.
Exactly. The power is in your hands to choose your response.
It's hard to implement. It's really hard to implement, especially if one is sensitive, one has had the habit of taking things personally, one is afraid that people might be upset with them or whatever. It's very hard to not try and manage someone else's emotions or reactions or responses to something you say, but that kind of managing ends up leading to a lack of boundaries and a lack of self-care very often.
Sometimes the reason why people resist allowing others the behavior that they feel is unacceptable for them. And so the question, is where do I put the boundary and how do I implement my border? It's just something I think about a lot these days as we are in the US, starting to treat immigrants like terrorists. It's like, okay, if you break the law, how do I respond to that? If you break my boundary, do I now have the right to destroy you because you broke the boundary, or do I have to still show some empathy for that? But that being said, back to your example of perfectionism. So people who are perfectionists typically fall into the obsessive compulsive category. It can be a good thing, of course, right? And this is something very important to mention, is that all these personality disorders, they always start as a very good thing, right? To be very sensitive, to be attached to somebody, that you don't want them to abandon you, or to feel like you want to be strong for the partner you're with, or attractive to, a lot of people. That can be a very good trait. The problem comes when you have too much of it, and when your behavior bumps into boundaries of the other or even social norms. And so there's another key idea to integrate in all of this, which is the idea of ego syntonicity versus dystonicity. So for a perfectionist person, initially the choice is, I'm a perfectionist because I want to be the best musician I can be. right? And the only way to do that is to be obsessive about practicing and playing and, thinking about music all the time. Okay, great. But then it becomes potentially too much at some point that it creates interpersonal stress. However, as a person, you might still say, my choice is to become the best at what I'm doing, so I'm going to continue doing it because it pleases my ego. And then comes a point where suddenly you say, wait, by doing that, I'm also destroying some of the other things in my life that are very important. So maybe I need to put that, goal of being the best in check. I have to put some boundaries on it, right? And so at this point, you realize that you have displeased your ego somehow and you change your behavior. This distinction, egosyntonic, ego dystonic, was, I think, first codified or introduced by Sigmund Freud, in fact, when he talked about narcissism and the fact that for many narcissists, having a narcissistic behavior is pleasing to their ego. And they cannot imagine not doing that. But the moment that you realize, okay, I'm actually destroying people around me by having this super strong personality I'm trying to impose on others, when in fact, inside it's a quite fragile ego, then I am opening myself to change. I'm opening myself potentially to therapy. And so the challenge of personality disorder is that many people who have them don't recognize they have a disorder.
Well, because it takes self awareness to be able to look in the mirror
Exactly.
somewhat objectively and be able to see the harsh reality, accept the harsh truth, and then make the decision whether you have the willingness to open Pandora's box and go through the difficult sort of journey of change and rewiring. And some people choose to do that, some people don't choose to do that. There's absolutely no judgment one way or the other. In my very limited life experience, very often I have seen that those with narcissistic personality traits or disorders tend to have a big lack of self awareness, or maybe they are self aware to a certain extent, but there is a lack of desire to change, maybe.
Yes.
But that's a very specific case, I think.
Yes, correct, correct. So ego syntonicity, is sort of a force within us that can lead to greatness, but if it's not kept in check at some point, it can lead to permanent behaviors that are destructive or self-destructive. Within narcissism, there's an important distinction, which is competent narcissism and incompetent narcissism, right? And so somebody could be great as the CEO of a company because they have that narcissistic drive, I would say, to change the world. They have competency in there, but then they move their thirst for power from, their company to maybe wanting to lead a whole country and something like that, and may not necessarily have the same competence. I think it's important to recognize this idea of ego dystonicity. For a lot of people with mood disorders, ego dystonicity comes naturally because they hit a low point in their moods for so long, like several weeks, that they realize, okay, there is something about me that I need to change. Challenge of many personality disorders is that the lows are hit for short moments, potentially few hours to a few days, and then the person comes back up and they don't view necessarily the problem that was created as something that needs to be changed, cared for. um, I think you had a previous guest who had a podcast with you in June 2022 named Dr. Vishwajit Ningaonkar,
Correct.
and he talked about insights, right?
Right.
And so insights in medicine, in psychiatry in particular, is important for people to recognize that they have a problem that needs to be addressed. And sometimes people with personality disorders don't have that insight at the height of their disorder, I would say.
Wow, there's so much to talk about. And I do want to ask one last question. As you've been walking us through the different types of personality disorders, and I'm listening to the names of different disorders and some of the definitions or descriptions of certain disorders, I felt like I was self-diagnosing myself, saying like, oh, well, then I must have this and this and this and this. And I think it's kind of a common issue in our society that we tend to self-diagnose a lot. And I would say even self-misdiagnose a lot, as well as misdiagnosing others or characterizing people in a certain way, sort of like throwing out buzzwords without really understanding the full terms of the disorders. As I mentioned in the beginning, what is being done in terms of more awareness publicly about diagnoses and to help us as a society not to just self-diagnose ourselves or others, particularly in a mischaracterizing way?
Well, so it's a good question. It has multiple answers, depending where we stand in society, in which country we are. There's still a vast difference, I would say, from developed countries or developing countries where traumatic situations are more commonly found potentially than in more developed countries. The words like borderline, narcissists are used by the psychiatric profession, but also have meanings on the street. Someone who is borderline on the street is viewed as somewhat problematic, but it's a different type of problems potentially than the borderline personality. Same thing with narcissistic. People will throw that around for someone who is potentially selfish. There is a continuum from being selfish to being narcissistic, I would say. It's important to view the world on a series of scales and dimensions. The model of personality disorders that I've talked about in the DSM is being changed by the ICD classification that's used a lot in Europe in particular and throughout the rest of the world. It is not distinguishing 10 disorders, but only a few. The classification is changing. There's also a problem with the fact that in countries like the UK, with the National Health Service providing access to personal data to practitioners who care for patients, receiving a diagnosis of personality disorders can lead to being treated differently by the medical profession, because people think that if you have a personality disorders, you will be potentially a problematic patient, and therefore they may not give you the same level of care, or even may refuse to take you on as a patient.
Which, of course, is absolutely unjust, unfair, and stigmatizing once again.
It can be, right. Now, I will say that I've also met a very nice therapist who, were on the edge of retirement and told me that in their whole career, the only two patients they had issues with were people who had personality issues and who ended up becoming threatening, or, to the point where they were scared. I will say that it's difficult to really understand what it feels like to be in close relationship with someone with a personality disorder and who can have like a blowtorch in your face for something that you felt was not deserving that reaction. All of this to say that the model is evolving. In the US, there is a famous psychiatrist named John Oldham who has proposed an alternative model of personality. And it is in the third book of the DSM, presented as something that may be a better way to diagnose people than through the traditional model, which I haven't talked much about. But in the traditional model, they sort of throw at you 8 or 9 criteria. And then if you have 5 of these criteria, you're considered as having the disorder. The challenge of this traditional method is that you're sort of on or off. Okay, you have BPD or you don't have BPD. Instead of having a much more gradual view where, maybe the gradient goes from 0 to 36, and maybe I'm a 5 and the person over there is a 13, right? And then you can decide, okay, if you're over 9 or 10, then you have a problem, right? Almost like with addiction, right? At what point do you decide that you have certain addiction? Connected to personality, as I mentioned before, is sexuality, which is very important. So the model of sexual addiction is an interesting one to consider in comparison to personality disorders, to see at what point does it really become a problem. And so the personality types are still evolving. I want to also say that one question that has fascinated me from the start, especially as a parent, was to understand the potential transmission of personality disorder to other people, including to our children. There are studies that are made about mothers with borderline or fathers with narcissism on the impact it has on their children. And of course, they can be narcissistic women, it can be borderline men as well. And unfortunately, those sometimes are not recognized as much or as quickly. But understanding the transmission of personality disorders is a very interesting topic. And I've talked about it when I gave my first conference in 2011 for an EABPD. So emotions tend to be contagious, right? And you know this as an artist, Pallavi, that you can create emotions in people through your music, right? And music especially is a great vehicle for, I would say, contaminating other people with emotions. But then the question is, can emotional dysregulation be contagious? And so if I overreact due to my emotion, is that something that might have become part of my personality due to my upbringing or due to contacts I had as a child? I hope eventually we will develop an epidemiology of emotions and of emotional dysregulation, because I think that a lot of the transmission of emotions happen through tiny little communications between people that are like at the level of viruses compared to our cells, which are even much smaller than our bodies. Similarly, I think that there are unspoken, maybe just a look or a feeling that can contaminate people with a sense of emotions that can become extreme. And I'm hoping that eventually we will realize that in the world we live in, we do unfortunately sometimes send toxic messages to others. We will learn to clean this up a lot more. So in the same way as, hygiene has changed the world, right? In the last 200 years, sometimes people wonder, how did tuberculosis disappear? The main reason tuberculosis is gone is because we take showers every day. We wash our hands. We clean our food before we eat it. The stores are clean and things like that. And similarly, upbringing, parenting, education has changed a lot, right? Most schools don't hit kids anymore. Most parents don't hit kids. In fact, by now there's 63 countries that have made spanking children illegal. And some of these countries, like Sweden, have done it now for, I think, 45 years, something like that. And the world hasn't gone to hell by making spanking illegal. So people realize, oh, maybe there's a way to raise children without putting fear in them. By doing that, we raise better people, right? And so my hope for 100 years from now is that the world of mental health will evolve like the world of physical health has evolved thanks to hygiene and better communication. We have understood virology. We've lived through pandemics that made us realize that, sometimes just breathing towards a person can actually be dangerous. And similarly, in mental health, maybe there are ways we need to discover certain ways of saying things to somebody. There are better ways of saying it, more healthy ways to say it.
Absolutely. And sort of the bottom line I take from everything we've talked about today is a reminder that nothing in this world is black or white, good or bad, right or wrong, one way or the other. Everything is sort of a spectrum, and there are different levels and layers and grades of everything. We are complex, multi layered human beings, and to allow both ourselves compassion and empathy and others compassion and empathy, I think hopefully will help to create a much healthier world all around.
Yes, yes. I think your podcast is wonderful, amazing, and a welcoming place for people to hear about these ideas. And so I really thank you for not only being a great pianist I had a chance to listen to and fell in love with your music, but also devoting your time to raising awareness for better mental health.
Thank you so much. I appreciate you saying that and It's something I'm very passionate about and something I feel very strongly about, because at the end of the day, if all of us are able to be just a little bit better, it contributes globally to a better society and better humanity. But thank you so much for being here with us today. This was an extremely enlightening conversation, very educational, and I really hope that our listeners have learned something. I'm going to add links to both your foundation and other relevant websites and resources in the podcast episode information so that our guests can have a chance to see your work directly and reach out to resources should they need.
I would say also that, social media and in particular the Facebook page of PDAN have been sort of a perfect storm that allowed us to radiate some of these ideas to millions of people. So if people want to join us through the PDAN page in Facebook, that would be a great place to start.
Absolutely. I will link everything in the description. Thank you so much for joining us today.
Thank you, Paravi, again. Take care.
Thank you all so much for listening. I am truly grateful for the support. Please share this episode and this podcast, because the more awareness we bring to mental health, the sooner we can break the stigmas around these topics and the faster we can help make our world a healthier place. Don't forget to subscribe wherever you get your podcasts, and see you next week for another episode of The Conscious Artist.